Have you ever wondered what role your liver plays in your overall health, or what could happen if it starts to fail? Your liver, the largest internal organ, performs an orchestra of functions crucial for your survival. It purifies your blood, aids in digestion, and regulates your body's metabolism. But what if this multifaceted organ begins to falter? Liver disease, a silent yet potent threat, is a term that encapsulates a spectrum of conditions that progressively damage the liver. It's a creeping menace, with symptoms often remaining hidden until the disease has advanced. It affects nearly 2% of adults in the United States, claiming around 57,000 lives annually. Whether it's due to viral infections, toxic poisoning, or certain metabolic conditions, liver disease can stealthily evolve through stages from hepatitis to fibrosis to cirrhosis and ultimately liver failure. But just like the liver silently carries out its vital functions, liver disease too often operates undercover, with signs such as jaundice, fatigue, and fluid retention only surfacing when liver function declines significantly. Understanding liver disease is the first step towards prevention. Join us as we delve into this important topic. So, what exactly is liver disease and how does it affect the body? Liver disease isn't a singular condition, but rather a broad term that encompasses a variety of health issues that can cause damage to the liver over time. Imagine the liver as a bustling city. Now picture a series of events that progressively disrupt the city's operations, causing damage that accumulates over time. That's the essence of liver disease. The saga of liver disease often begins with hepatitis, an inflammation of the liver. This inflammation can be triggered by various factors such as viral infections, toxic poisoning, and certain metabolic conditions. Much like a city under siege, the inflamed liver struggles to keep up with its crucial functions. If this inflammation persists, it paves the way for fibrosis, a stage where the liver starts to scar. It's akin to the city's infrastructure beginning to crumble. The liver, however, is a resilient organ and can still function relatively well at this stage. But if the scarring continues unchecked, we enter the phase of cirrhosis. This is where the scarring becomes so extensive that the liver's ability to function is significantly impaired. It's like our city's infrastructure has deteriorated to the point where day-to-day operations are severely affected. The final stage is liver failure, where the liver is so damaged that it stops working altogether. It's the equivalent of our city falling into complete disarray, unable to sustain its operations. The various causes of liver disease, viral infections, toxic poisoning, and specific metabolic conditions are like different threats that can attack our city. They can strike singly or in combination, leading to different types of liver diseases, each with its unique progression and impact. Now that we understand what liver disease is, let's explore the signs and symptoms. Liver disease is often silent, but there are signs and symptoms to watch out for. Let's delve into the symptoms of liver disease. Early stages of liver disease might be a silent passenger in your body, showing no outward signs. This is because your liver, a resilient and hard-working organ, continues to function even when it's damaged. It's only when the harm becomes severe or prolonged that symptoms start to emerge. As liver function declines, several symptoms may start to make themselves known. One of these is jaundice, a condition where your skin and the whites of your eyes turn yellow. This happens when your liver can't effectively process bilirubin, a byproduct of old red blood cells. Your body might feel like it's running on empty, resulting in fatigue that doesn't seem to lift, no matter how much rest you get. This is because your liver plays a crucial role in energy production. Fluid retention, particularly in the legs and abdomen, is another sign to watch out for. This occurs when the liver loses its ability to make proteins that keep fluid in the bloodstream. As a result, fluid leaks out and accumulates in these areas, causing discomfort and swelling. Other symptoms can include unexplained weight loss or gain, loss of appetite, nausea or vomiting, and changes in stool color or consistency. You might also notice a tendency to bruise easily, itchy skin, or confusion and difficulty thinking. The symptoms of liver disease are varied and can often be mistaken for other conditions, which is why they can be overlooked. However, they are your body's way of sending out a distress signal, a cry for help that something is amiss. If you notice any of these symptoms, it's crucial to seek medical advice. Early recognition and treatment can prevent permanent damage, so don't ignore the signs. Your liver is too important to neglect. Remember, it's not just about finding the cure, it's about preventing the damage in the first place. End-stage liver disease can lead to serious complications. Let's dive deeper into what these complications might look like. As liver disease progresses, the organ's ability to perform its key functions diminishes, setting the stage for a host of health problems. One such complication is portal hypertension. This condition occurs when the liver is so scarred that it obstructs the flow of blood through the portal vein, the major vein leading to the liver. As pressure builds, it can cause veins in the esophagus and stomach to swell, creating a risk for life-threatening bleeding. This is not a minor concern, and it underscores the severity of advanced liver disease. Then we have hepatic encephalopathy, a brain disorder that develops when the liver is unable to remove toxins from the blood. This can lead to confusion, lethargy, and in severe cases, coma. Liver disease can also lead to kidney dysfunction known as hepatorenal syndrome. This condition, triggered by severe portal hypertension, can result in kidney failure, a serious complication that requires immediate medical intervention. And let's not forget primary liver cancer. Liver disease, particularly cirrhosis, significantly increases the risk of developing this type of cancer. Unlike other forms of cancer, primary liver cancer originates in the liver itself, making it an especially menacing complication of liver disease. These complications are just a few examples of what can happen when liver disease reaches its advanced stages. Each one carries its own set of challenges and risks, further underscoring the importance of maintaining a healthy liver. The complications of liver disease are severe, which is why early detection and treatment are so vital. So let's remember, our liver plays a crucial role in our overall health and well-being. Protecting it should be a priority for us all. While liver disease is a serious condition, there are treatments available. Let's delve into this a bit more. The primary treatment for liver disease often involves lifestyle changes. This could mean a change in diet, reducing or eliminating alcohol consumption, or incorporating regular exercise into your routine. It's about creating a healthier environment for your liver to function. In some cases, it might mean losing weight. Obesity can lead to non-alcoholic fatty liver disease, so maintaining a healthy weight is crucial. It's not about overnight changes, but a long-term commitment to a healthier you. Now, depending on the cause of the liver disease, specific medical treatments may be necessary. For instance, if liver disease is caused by a viral infection like hepatitis, antiviral medication might be prescribed to help control the virus and slow down any liver damage. In cases of toxic poisoning, the treatment might involve removing the source of the poison, whether it's a medication, substance, or even certain types of food. For those with advanced liver disease, such as cirrhosis or liver failure, more aggressive treatments may be needed. This could involve procedures to control complications, or in severe cases, a liver transplant may be considered. It's important to remember that every person and every liver is unique, so treatment will vary from person to person. That's why it's so important to work closely with your healthcare provider to come up with a treatment plan tailored to your specific needs. With the right treatment and early detection, liver disease can often be managed. It's not an easy road, but with commitment and support, it's a journey that can lead to a healthier, happier life. Scene script: prevention is always better than cure. So how can we prevent liver disease? Indeed, prevention is the key to maintaining a healthy liver and avoiding the potentially devastating effects of liver disease. One of the most effective ways to prevent liver disease is to maintain a balanced and nutritious diet. Consuming a variety of fruits, vegetables, lean proteins, and whole grains can provide your liver with the nutrients it needs to function optimally. In addition, reducing your intake of fatty, sugary, and processed foods can help prevent the buildup of fat in your liver, a condition known as fatty liver disease, which can lead to cirrhosis if left unchecked. Regular exercise is another crucial component of liver health. Engaging in physical activity for at least 30 minutes each day can help maintain a healthy weight and reduce the risk of fatty liver disease. Exercise also increases circulation and helps your liver to detoxify harmful substances more efficiently. And then there's alcohol. While moderate consumption may not pose a significant threat, excessive or chronic alcohol use can cause severe damage to your liver. Alcohol can lead to inflammation and swelling, which over time can result in fibrosis, cirrhosis, and even liver failure. If you choose to drink, do so responsibly and in moderation. If you're struggling with alcohol dependency, seek professional help. Avoiding exposure to harmful substances is also essential. Certain toxins and chemicals found in cleaning products, pesticides, and even some medications can cause liver damage. Always use these products as directed and in a well-ventilated area. Lastly, ensure you're vaccinated against hepatitis A and B, as these viral infections can cause serious damage to your liver. Regular checkups and screenings can also help detect any potential issues early when treatment is most effective. Remember, taking care of your liver means taking care of your overall health. The decisions you make today can significantly impact your liver health in the future. So make the right choices and give your liver the care it needs to keep you healthy and thriving. In conclusion, liver disease is a serious condition that affects many people. It's a silent threat that can progressively damage the liver over time, often with no apparent symptoms in the early stages. It's crucial to understand this condition, recognize the potential signs such as fatigue, jaundice, and fluid retention, and seek medical attention as soon as possible. The complications of liver disease can be severe, including portal hypertension and primary liver cancer. However, with early recognition and appropriate treatment, further damage can be prevented. Treatments can range from lifestyle changes to specific medical interventions, depending on the underlying cause of the disease. Prevention, as they say, is better than cure. Regular checkups, a balanced diet, and a healthy lifestyle go a long way in keeping liver disease at bay. It's also essential to be informed and proactive about your health. Your health is in your hands. If you have any concerns about liver disease, don't hesitate to seek medical advice.